friends. I am Dr. Harvinder Singh. Welcome to Psychiatry Education Forum Academy's next discussion series. And here I will be talking about this clinically relevant topic from geriatric psychiatry. And the topic is evaluating neurocognitive domains for evaluation of dementia neurocognitive disorders. And to make it more easy and not very long discussion, I have decided to make it a lecture series in following 6 sections of 6 neurocognitive domains. So we know we have these 6 domains that we need to evaluate, and that can help us even point in direction of specific subtypes of dementia. And these domains are complex attention, executive function, learning and memory, language, perceptual-motor, functioning, and social cognition. And this discussion today will be focused on complex attention only. And complex attention is actually divided into 4 sections, which are sustained attention, selective attention, divided attention, and processing speed. Actually, working memory comes in that, but I will talk more of that in the memory section. Now, what I will do is I will try to give some examples, mainly from the DSM-5, and we'll talk about some tests that you can use in your clinical practice. Please note, I will not talk about the neuropsychological testing that is more detailed, but my focus is only for busy clinical professionals. So these tests you can do when you evaluate somebody with cognitive impairment. So let's start with the sustained attention first. So what is sustained attention? Well, it's the ability to sustain attention over a long time, also known as vigilance, like how vigilant you are over the course of the time. And if you go by examples, these are the examples like a person will say they're not able to maintain attention over time. They have difficulty holding new information, like most recent one, like new address or phone number given to them. And you will see this also goes in line of that short-term memory impairment. So all these neurocognitive disorders somehow are connected with some other domains. So be mindful of that there is no one clear example for few of these things that we'll talk about. So how can we test somebody's sustained attention? Well, if you go by neuropsychological test, there is something called CPT, which is continuous performance task. But let's go over the tasks that we can perform in our clinic. And also I want to mention here is I will not be showing anything from copyrighted scales like MoCA or mini mental status exam. So let's go over the testing for sustained attention now. So you can ask your patient to tap on a desk each time specific number or alphabet is heard. And you know in MoCA they have this specific option. For example, you can ask your patient to tap on a desk each time they hear A. So you can say something like B, C, A. They have to tap at that time, and you can keep on going over the course of a time. Preferably 1 minute should be good to check on that. And also, you see the processing speed is in the end. I will talk about that. But all the tasks that we do, you check their processing speed also with every test, how fast or slow or delayed their processing speed is. So coming back to the sustained attention. So that's how you test that. And when you do psychological testing, you can ask them to press a button every time a tone is heard. And so you got the theme, how you check for sustained attention. Now, going to the selective attention. So we already know what sustained attention is, but what is selective attention? So selective attention is the process of only attending to the relevant information or important information and ignoring the non-relevant information. So this is very, very important. So what clinical information you will see? How can a patient present with issues with selective attention here? So here is an example. So when there are multiple inputs happening in the background, multiple stimulus, like if there is a TV or a radio or many people talking, so they have difficulty maintaining attention. Some people say they get tired very easily, and this actually we'll talk about this in other neurocognitive domain also moving forward. But that is a very typical example of selective attention deficit happening. And how can you assess that? So here is an interesting example. You can actually read both alphabets and number and ask your patient to only count the alphabets. That way they can tell you the results in the end. And when you do that, it can also check the sustained attention, I assume, because if you're doing it for good time, you need sustained attention for that also. Now, that was selective attention. Now, moving to the next one, which is divided attention, which is, difficulty attending to two tasks at the same time, which I think goes very well with the selective attention also. So in selective attention, you're focusing on one thing. In divided attention, you're focusing on two things at one time. For example, we all know there's a storytelling in slums, right? SLUMS, which is available for free. You can do that reading of a story and also ask a patient to tap rapidly. This is like two tasks, and then when you ask questions from the story, that can show their ability to do the divided attention at that time. And then the last part in complex attention is the processing speed. And examples are, the normal task will take longer than usual unless some family member or caregiver simplifies them. And you can get this information from family or caregiver. But a person can also, volunteer this information in mild cognitive impairment. They can say they are doing more double checking than before, and they are finding more errors or frequent errors in the routine task compared to past. And how do you assess processing speed? As I mentioned, you can check, their speed in answering any of the things that we talked about before in any of the tasks. But what I will do is in few minutes, I will show you few of the tasks that you can do also for more detailed attention evaluation. But before we go there, what is the significance of all this? What subtype of neurocognitive disorder or dementia have more dominance of the complex attention issue? And the answer is vascular dementia. So when you look at the DSM-5 criteria for vascular neurocognitive disorder, so the number one criteria is, we all know that either there should be a temporal association with the onset of cognitive deficit and one or more cerebrovascular events, right? But what is the second one, which can also clarify the diagnosis of vascular dementia, is that there should be evidence for the evidence for decline is prominent in complex attention, including the processing speed and frontal executive function. We'll talk about the executive function domain in the next discussion. But there is a prominent decline in the complex attention neurocognitive domain in vascular dementia. So when you see this, I think it's very, very important to look for the, a cerebrovascular event, temporal association with that. But that doesn't mean that this points to vascular dementia, because we know that other neurocognitive disorders have, there are specific patterns of neurocognitive domains involvement. Like in Alzheimer's dementia, mostly what we see is memory and learning is impaired, but it can also have one or more other neurocognitive domains involved. But if I have to summarize, keep vascular dementia in mind when you see prominent complex attention issues happening. Now I will end this session by talking about a scale that you can use in your daily practice. I have not included mini mental status exam or MOCA here because they're copyrighted now. So the scale that I use and prefer, which is available for free and no copyright issues there, is the Addend Brooks Cognitive Exam 3, ACE 3. They actually check the attention in 3 sections. The first is the orientation, which I have not included here. In orientation, you ask, how oriented they are to time, place, person, location, and those things. But the second is this one. In this attention, you ask the patient to repeat and remember 3 words. Speak slowly when you do that, and repeat the word if necessary, but don't repeat more than 3 times. And tell your patient that you will ask for this information later. And you can score from 0 to 3, and also look at the number of trials. But you see, this also goes with that short-term memory thing, and you got the point, right? The attention part, complex attention, also translate into that early short-term memory impairment. So you can check both with this one. So this is an important test that you can do. The 3-word repeat after a few minutes, it can check both of those. And the other thing that ACE3 will help us do is this one. You ask a patient to subtract 7 from 100, record the answer, and then ask your patient to keep subtracting 7 from each number until you ask them to stop. Now, again, this goes into the other neurocognitive domains also, but talking about the complex attention, this can actually test so many of the topics that we just talked about. Their sustained attention for a long time, and if you want to make it more complicated, you can have them tap or do other tasks to look for divided attention and more. So friends, this was our first section on complex attention. If you are interested in learning more, join the Psychiatry Education Forum Academy. But for all our Academy members, I will see you in the second section on executive function. Thank you and bye for now.